Just because you've been told you have a cataract, it doesn't necessarily mean you need to do something about it, at least not right away. Dr. Richard Yem is a cataract surgeon with Eye Surgeons Associates and is here with some answers to the question, when do I need cataract surgery? Thanks for coming in.
Thanks, Marcia.
Let's start by explaining to those who may not know what is a cataract?
Sure. So a cataract is clouding of the lens inside the eye, and this is the natural lens that we're all born with. It tends to occur gradually over the course of many years, typically accelerating in patients' 60s or 70s. But it can actually happen at any age. So things like diabetes or an injury to the eye or certain medications even can cause cataracts to come on a little more quickly.
And what are some of the common symptoms of a cataract?
Yeah, so cataracts really don't cause any harm to the eyes themselves. There's no discomfort from a cataract, but they can significantly impact the vision. And so patients tend to notice kind of generalized blurring of the vision, and that might affect reading, it might affect things like needing more light to read, driving, seeing street signs, and also patients often report difficulty driving at nighttime, especially with glare from oncoming headlights.
So when it comes to a cataract diagnosis, when would a patient start looking at signs to do something? What are some of the indications that, oh, maybe now I need to act?
Right, so it really comes down to, we want patients to actually be bothered by their symptoms. We want there to be some level of impairment before we would go in and consider surgery. So whether that's, the difficulty with seeing the television, with reading, with driving, it could be outdoor activities like golf or watching a ball game or just doing chores around the house. When those things start to become more difficult and patients are being challenged to see during those activities, that's when we consider doing surgery.
Yeah, and I thought it was interesting that it also can affect color.
It can. Yeah,
And
absolutely.
How is that?
Well, the lens just becomes a little more yellowed as it matures. And so it happens very gradually. Patients don't realize that that's actually going on. When you take the cataract out, often we'll do one eye and the other one hasn't been done yet. That's the first thing people notice, is that difference in color. Everything's very bright and vibrant when the cataract has been removed, and then they'll close that eye and the other eye kind of looks a little yellow. Yeah,
you can see that in this image. The image on the right is kind of yellowed and brown compared to the vibrant colors on the left. So doctors also have kind of a list of things that they do to determine when it's time to do cataract surgery. What are the things that you do?
That's right. So I'll take a look at the patients with the microscope. It's very easy for your eye doctor to tell when the cataract is present. We also look at the rest of the eye to make sure there aren't any other limiting factors in the vision that could account for a decrease in vision. And then we also check to see if an improvement on eyeglasses, new glasses, will help correct the vision at all. And if we think that a cataract is present and glasses aren't improving the vision enough, then we consider proceeding with surgery.
So why not just go ahead, if I've been diagnosed with a cataract, just go ahead and have cataract surgery? Why wait?
Right. So when we remove the cataract, we're taking the actual lens out of the eye, and that has to be replaced with a clear lens implant. And even the best implant on the market today can't replicate exactly what the natural healthy lens in an eye can do. And so we want to wait until the cataract is bad enough where there's a substantial improvement in vision that we would expect to justify going in and undergoing risk of surgery.
Yeah, so even though it's failing, what you were born with still works better.
That's correct, yeah.
All makes sense. Well, Dr. Yem with Eye Surgeons Associates, thanks so much for coming.
Yeah, thanks for having me.